Hi, I'm Mary Colbert, and welcome to Dr. Colbert's Divine Health Podcast and YouTube channel. We are continuing today a very important topic, what you can do to save your gallbladder. If you haven't lost it already, we can help you. I really believe your information can help.
I know it can. And again, you may be one of those 10 to 15% or higher of the population that has gallbladder problems, biliary colic or acute cholecystitis, or you've had chronic gallbladder disease, or you may have had your gallbladder removed and you're having now all the problems with diarrhea or irritable bowel type symptoms and problems like that. So we have the answer for this. But again, it's that gnawing, gripping pain in the right upper quadrant right here that so many people have the problem right under the rib cage. That's where it is. When I press, and when patients come in, and what I do is I check for a positive Murphy sign. Now I check, I have them take a deep breath, and then I say breathe. Take a deep breath. They breathe. And as soon as they take that deep breath, I press in there, and then they have what we call respiratory arrest. It arrests their respiration. They're in severe pain typically as I touch the gallbladder when it's in spasm or if they're in biliary colic or acute cholecystitis. And then an ultrasound of the gallbladder will show me if it's sludge or if it's stones. Sometimes sludge doesn't show up. And so they just say, well, go home, there's nothing wrong, but yes, there is something wrong. And then they have to have a HIDA scan, H-I-D-A, that reveals the gallbladder's ejection fraction is abnormal, it's not contracting right. Now we can help that and save the gallbladder by flushing it out, or we can use beets or some phosphatidylcholine and other nutrients to flush it out. And we're going to be talking about that now. What supplements help the gallbladder? But first, before we do that, we've got to take away the bad because people are eating the saturated fats that's clogging their gallbladder up.
Okay, before you go there, let me just ask you a question. Can it be misunderstood as a possible heart attack?
Yes, absolutely.
So that can,
People sometimes they go to the ER, they're having chest pain. And because gallbladder pain can be substernal, just like a heart attack.
Okay.
Or they can think it's reflux or acid reflux. And so they go to the doctor, and so they've checked an ultrasound. They didn't see the sludge, they missed it. And all of a sudden, then they're going in for a heart cath to see if they've got heart disease.
Yikes, and it's gallbladder.
And it's gallbladder.
Oh, gee. Okay, so let me ask you this. Belching, is that associated
with? Belching, absolutely. So
with gallbladder?
I had a lady this last week. She was belching. And
that's a sign.
That's a sign. Some people just have excessive belching, yes.
Okay.
And that's many times their gallbladder. Or it could be not enough enzymes that in their diet. They may have to have digestive enzymes.
Okay.
But that is sometimes a sign. Nausea and vomiting, cramping right upper quadrant, pains that radiate around to their shoulder blade, their upper back, their mid back, or substernal is another sign. And like I say, with the nausea. But a major thing is right here, when you press right here, you go in your lower rib cage and you find between these ribs, you find the lower rib cage and then you press between the ribs right here, I think it's 8 and 9. People with gallstones or sludge, it hurts like the dickens. It's like someone has a red hot poker. And they literally come off of my table. And what I do is I usually put a laser, I have a special laser that has the gallbladder frequencies. I put it on there and then the pain usually just goes right away. It's absolutely amazing. And then I put them on a gallbladder diet. You say, what's a gallbladder diet? It's the Beyond Keto diet. You see, olive oil helps to flush out the gallstones, but you just want a little starting out and then gradually increase it. But cut out the foods that are causing the sludge. All the high fat, saturated fats, the butter, the cream, the cheese. I had a person with biliary colic come in. I said, what are you eating daily? Your cholesterol's 300. A lady, she was like 45, severe biliary colic, would come and go. And she says, well, I'm making coffee and I'm putting a tablespoon of butter in my coffee. And I'm drinking it 3 times a day. I said, well, no wonder, there you go. And also cheese. Some people on the unhealthy keto diet will eat slabs of cheese. Right. They'll eat tons of butter. They'll eat lots of cream. They'll put just heavy cream in their coffee. Now you say, well, that's okay short term, but if you have gallbladder disease, you're adding fuel to the fire. So you've got to cut those saturated fats way low and use the healthy fats in my Beyond Keto diet, the olive oil, the avocado oil, the macadamia nut oil, and also your nuts and your seeds and things like that, and your salads. Like today, I had a nice big salad. I poured like 4 tablespoons of my high polyphenol olive oil all over my salad. I feel totally satisfied, yet I gave my liver and gallbladder the best thing that could have is that high polyphenol olive oil. It's wonderful for your gallbladder. Now, if you have sludge in your gallbladder, don't do that right off. You start with little teeny amounts. Don't use 4 tablespoons or you'll put your gallbladder in spasm. You just start with maybe a teaspoon or a half teaspoon. But you start transitioning into this program.
But Don, I think that's a good idea just to show people that if you have that area right there.
And here's all you do to find it. You first find the margin of your rib cage, the lower margin. Then you go right over here and just one rib up, 1 or 2 ribs up is that gallbladder point. You just press, and if it's real sore, signs are you've got sludge in there, and you need to listen because we're going to be talking about how to flush it out. The first thing you got to do is you got to lower those saturated fats. Now, going back to the diet, we find that for many with gallbladder sludge in there, you've got to do more of a Mediterranean diet and less fat starting out. So the Mediterranean diet has lots of beans and peas and lentils and broccoli and onions and garlic and foods that actually take the stress off the gallbladder. Okay. And fiber like your steel cut oatmeal and things like that.
Okay, gallbladder flush. What can they do if they feel that it's tender and sensitive?
Now if a person just has sludge, I've done an ultrasound of their gallbladder. I see that they have no stones in there, or if their stones are little, they're like 1 or 2 millimeters, they may have a bunch of little stones, then I'll do a gallbladder flush on them. And I'm going to teach you about that in a minute. You just got to make sure a few things. You can't, if you're less than 18, you shouldn't do it. We don't do this in children.
Okay.
Number 2, we don't do this if you're pregnant or if you're lactating. You do not want to do that. And you need to have a gallbladder ultrasound first because you've got stones in there that are over 3 millimeters, or 3.5 or above. They could get caught in your common bile duct or your cystic duct, and you could have emergency surgery. So you want to get that ultrasound to make sure. That's really important. And then if you're on medicines, you may have to continue some meds. And we try and stop the supplements for a day or 2 while you're doing the flush. So you got to do the day before and the day of the flush. But we're going to be talking about the flush in a minute. First, I'm going to be talking about simple supplements they can get over the counter that for many, these are adequate and they don't even need the flush. Now, some,
and it can actually dissolve whatever's in there.
The sludge. It'll dissolve the sludge.
That is such a beautiful thing.
And so it's so simple. Some people don't want to go through all the headache of going through the gallbladder flush and taking all that Epsom salt capsules. You got to take 15 capsules at 6 p.m. and then at 8 p.m. you got to take your flush at 9:45 p.m. Then in the morning at 6 a.m. you got to take 15 more Epsom salt capsules, and then at 8 a.m. you got to take 15 more, and then all these stones start to come out. And they float to the top. They're little greenish yellow stones. And it's amazing. People are absolutely amazed when they see it. So it does work, and some people need it, and some people do it once a year. I've got my patients over the years, they've done it once a year for decades, and they've not had any stones in it.
Is that in any of your books?
No, but we're going to put it on the website. We're going to type it out for the patient, put it on the website.
So our website's drcolbert.com, so you can go to there. We'll be putting that on this week.
Right. Now we're going to talk about supplements to help with gallbladder problems, especially biliary colic or cholecystitis mild. If it's mild, again, if it's serious, you get to the ER and get it out. We don't want to take a chance you're getting septic or the gallbladder exploding or gangrene of the gallbladder. But one of the best is phosphatidylcholine. You say, that's a mouthful. What is that? Phospho, P-H-A, tidyl, T-I-D-Y-L, choline, C-H-O-L-I-N-E.
That's a mouthful.
Or just say PC. And PC is a form, it's like lecithin, but it's much better than lecithin. Lecithin will not do what this can do.
Okay.
And a good one that I have patients get over the counter is Body Bio, B-I-O, PC. And you just take 2 capsules twice a day for about 6 weeks to 3 months. And that'll flush, what that does, that supplies the phosphatidylcholine, which is one of the main ingredients that helps the bile become more soluble, that will help to prevent and reverse sludge in the gallbladder. It's amazing for sludge, amazing.
And that's simple.
Yes, and what it does, it increases the solubility of bile and the excretion of cholesterol to prevent gallbladder stasis. and the formation of gallstones. And the PC constitutes as much as 40% of the organic material in the bile, and this helps to prevent gallstones, helps to dissolve gallstones and sludge in the gallbladder.
Wow.
Now, if people are allergic to soy, we use the PC, or phosphatidylcholine, that comes from sunflower seeds. So a company that has that is called Pure Encapsulations, PC. But you have to take double the amount. Oh. So instead of 2 capsules twice a day, you have to take 4 capsules twice a day. But some people are allergic or real sensitive to soy and they can't take.
So phosphatidylcholine is the basis, is soy?
The soy is the basis, but there's also from sunflower. So a lot of people can only take the sunflower. Now, I shouldn't say a lot. Some people can only take the sunflower PC, phosphatidylcholine. Okay. But that's the first supplement, and that works really good. The one that I like the most for people with mild biliary colic is just beets. Beets. And so people can take 1/2 to a whole beet, either blend it up, in a blender with some berries and some ice and some water to make you a beet juice, once or twice a day. Usually twice a day works best. Or they can add beets, make beet soup with 1/2 to a full beet, or they can add it to their salads, or they can take a supplement called beta TCP that you get online, and you take 2 before each meal 3 times a day for 6 weeks, and it works amazing at helping to get rid of the sludge out of the gallbladder. So they can get that online.
That's a concentration of beets in a pill.
Right, it just stimulates the flow of bile, and we're putting the beets also in my liver cleanse. I'm adding, it's going to be a gallbladder liver cleanse to our liver cleanse.
Ah, that'll be an important supplement.
Exactly. Now the other thing that really helps sludge in the gallbladder are bitters. Now you say bitters, what on earth are bitters? Doctors have been using bitters for hundreds of years. And bitters are the extraction of bitter herbs or seeds or roots or leaves or flowers or fruits. And what bitters do is bitter seeds or plants or things, components of plants, encourage digestion, and they encourage the effective flow of bile. They stimulate bile flow. Similar to beets, but it works even better for some people. Sometimes we'll use both the bitters with the beet extract, so you're getting even better flow of bile.
So is this bitter like
the one that I recommend? The one that I recommend is bitters number 9. You have to put bitters, bitters, and then NO period, and then 9 from Quicksilver. It's not my product; it's another product from Quicksilver. And you take 2 sprays and 2 to 4 ounces of water 3 times a day, usually for 6 weeks or so. And it'll just stimulate the flow of bile and just clean the gallbladder out.
Wow.
It's a gentle detox.
Wow.
And so it works really good for many people. Some people do it either before the meal or after the meal, but it supports healthy bile flow. Now what this has in it, it has these bitter herbs. It has dandelion, it has burdock root, and milk thistle.
Oh, I love the things that
it's all
are
natural.
in the earth, because the scripture says the herbs are for the healing of the nations.
Nations, amen.
I mean, that is God's medicine.
And these are great herbs for the gallbladder.
Yeah.
They work, they're bitter herbs.
That's
and then also they contain essential oils, myrrh, remember frankincense, gold, and myrrh were given to Jesus at his birth.
The healing,
Right, again, so again, it's myrrh, clove, juniper oil, and sweet orange, and it's liposomal. And so that's a wonderful supplement that's fairly inexpensive that they can do once a year, twice a year, 6 weeks usually.
Kind of a cleanse.
Yeah, or some people just stay on it. You can do that.
And you can get this at health food
And it helps
stores?
digestion. You have to get it online. No, they'll have bitters, but this is one of the best bitters I've found.
Oh.
There's a lot of bitters out there, bitter herbs and bitter seeds and leaves and flowers and fruits, but this seems to work the best for gallbladder that I've found. Now, there may be others out there, but this is one I found that works amazing for most of my patients.
Wow.
Now, also the gallbladder flush. You mentioned the gallbladder flush. This gallbladder flush, I have been using it off and on for 25, 30 years in patients. and some of our good friends have used it and passed many little gallstones. And they're amazed. Every time they do this, they call me, wow, you should have seen all the gallstones I passed this year. It's like, I said, you didn't stop eating that saturated fat, did you?
Their little gallbladder probably looks pregnant.
Well, they're small little stones. They're like 2 millimeters. They're like little marbles they're passing. They say, oh, they're green, they're yellow, they're floating. See, when you pass gallstones, the stool sinks, the gallstones will float. And so the people are really excited because the morning after they're flush at 6 and then 8 when they take their Epsom salt.
It comes through the bowel.
Yes, and you look at the stool and you say, oh my gosh. And some people take pictures of them. Some people bring them in the office and show me all their gallstones.
So there's marbles floating in the...
And they're so proud of their gallstones.
I don't remember swallowing marbles.
I know. So here,
I'm
the
losing
caution.
my marbles.
Yes, the caution is to do, number one, you do not do this flush when you're ill. If you're having an acute attack, do not do this. Do something minor. Do something the beets, or do the beta-TCP, or do the bitters. But don't do this if you're sick or ill or having nausea and vomiting. You can't do it. That's the wrong time to do it. You got to do it when you're well, okay? Do not take meds, vitamins, or other supplements that you can do without during the flush. Real important. If you're taking meds, check with your physician prior to taking any other supplements, okay? And then the liver gallbladder flush is only for adults 18 years of age or older, and not for children.
You, what's the most common age for this? You told us
usually
earlier.
40 to 60.
40, female, fertile. Yeah, you already
Fat,
told
fertile,
us that.
40
Sorry.
female, the 4 Fs.
The 4 Fs, okay.
And then also, do not do the gallbladder flush if you're pregnant or lactating. Now, before you do the flush, be sure and get a gallbladder ultrasound. You want to see how large your cystic duct is. It should be at least 3 millimeters. And most are 3 millimeters, but if your stones are 4 millimeters, don't do the flush. If they're 3.5, I wouldn't do the flush. Because now the cystic duct is 3 millimeters, the common bile duct is 3.5 millimeters on average. Yours may be smaller, so if you have big stones, do not do the flush, do the other.
That's good advice. Okay, so if someone is not sore and they don't have any issues with their gallbladder, but yet they're hearing this and going, man, that'd just be a good prevention.
Well, good question.
Yeah.
If they press and they find their rib cage and they go right between these ribs, right where I'm pointing right here, that's my rib cage right here on my left, where my left finger is.
I know it's
and right
hard
above
to
it is
see
here.
This. We'll try to show this as a diagram on the video.
Well, this is the main gallbladder point right here, and if that's real sore, then you do not want to do a gallbladder flush right now until you've kind of softened it up with the beta-TCP. But still, I wouldn't do it until I had an ultrasound. I wouldn't. I'm
saying if you don't have, it's not sore or anything. But
could you do it?
Yeah, you just listen to this and you say, wow, you know, I'd like to just do a gallbladder thing like the
I tell people,
stuff.
I personally wouldn't unless I did an ultrasound. Now, the beets are fine. The phosphatidyline's fine. The bitters are fine. All of those are fine.
Kind of help it.
Yeah, now those are good. Those are not going to trigger anything. Yes.
Something like that.
And that's what I'll do. I'll do some beets, or I'll do some phosphatidylcholine or some bitters. But,
I think I'm overdue.
But I wouldn't do a gallbladder flush unless I had an ultrasound.
Okay.
Okay, I wouldn't.
Gotcha. No, I agree.
Okay, now the liver produces 1 to 1.5 quarts of bile per day. And see, the bile ducts in a healthy liver allow the bile to flow easily down from the liver into the gallbladder and then into the duodenum. See, when you eat fat, the gallbladder contracts and releases that bile into the liver to digest the fats. Now, 2 weeks before doing the gallbladder flush, you want to have some liver detox tea. And you'll love this tea.
Oh, okay.
So you do it like 2 to 3 times a day is best. And all you do is you get a lemon, and you get a small piece of ginger. You slice the ginger up. You put it in 2 to 3 cups of boiling water, and then you chop the lemon peel up, and you put it in the boiling water. You squeeze the lemon first. You put the juice to the side. You don't want to boil that. You want to chop the lemon up, and you want to chop the small piece of ginger, and then you boil it. You bring it to a boil for 1 minute, then you let it cool. Once it cools, you add the lemon juice, and then that's your liver detox tea. And you do that 2 weeks before your gallbladder flush, 2 to 3 times a day.
Wow.
And what it does, it prepares your liver and gallbladder for the flush. Okay?
Wow.
Okay, now, You can also add stevia or monk fruit to it. Do not add erythritol because it has been associated with blood clots. We don't want to do that. And again, the gallbladder flush. So you want to get the supplies if you're going to do the gallbladder flush. The supplies are real simple. I've been using Dr. Clark's supplies for my patients for years. I just have them order from Dr. Clark online. And so you get Dr. Clark's Epsom salt capsules that have 1,030 milligrams of magnesium sulfate per capsule. Order online. I have them get Dr. Clark's black walnut capsules that's got wormwood, 258 milligrams per capsule, and cassia bark, 72 milligrams per capsule. Works amazing for parasites. And then I have them get Dr. Clark's L-ornithine capsules that are 500 milligrams. You say, what is this for? I'm going to explain it in just a minute. Then you have to get a bottle of organic olive oil. That's best high polyphenol, but you can just use regular organic olive oil like Newman's if you want. You want to get one whole grapefruit, or if you're sensitive to grapefruit or taking a medicine that's contraindicated, you can take 3 or 4 lemons and get the similar results. You want to have maple syrup, organic maple syrup, use 1 tablespoon of that, and you want to get a pint-sized mason jar, because you're going to have to put these ingredients in, you're going to have to shake it. You got to get all these ingredients ready the night before you do all this, because you want to have it all ready, because if you don't, you're going to be in trouble, okay? So some people will do a parasite cleanse a month prior to the gallbladder flush. And for a parasite cleanse, they usually use this organic diatomaceous earth, 1 teaspoon, in about 8 ounces of water, 1 hour before meals, 3 times a day, 10 days on, 7 days off, 10 days on, and that's it. And literally, people are amazed what they pass, okay? They come in telling me stories of all the critters they're passing in their stool, but it's amazing.
It does parasite cleanse?
Yes, it does.
And liver cleanse?
You notice I got a big old bag, big old huge sack of organic diatomaceous earth in our pantry, okay?
I saw that.
That's what I used it for back a year or 2 ago.
Okay.
And then 2 weeks before the gallbladder cleanse, you start drinking your liver detox tea with your lemon and with your ginger, like I told you before. Then, on the day of the gallbladder flush, you want to have a good breakfast with like some steel-cut oatmeal. You can put some stevia in there, like I do mine. You can put some blueberries or some strawberries in there, but you don't want to put any fats in there. No butter, no fat, or any fat on the day you do your gallbladder flush. Really important. And then if you do have to take meds, then take them, okay? Now, at 12 noon, you can eat up until 12 noon. And a lot of people will have like bone broth soup before noon, which is good, but no oil, no fat in it, okay? You can put a few veggies in it if you want. Okay, then after 12 noon, don't eat anything, but just drink 8 8-ounce glasses of water. That's what you have for the rest of the day. Now, at 6 p.m., it's real simple, folks. It's 6 p.m. and 8 p.m. at night, and then at 6 p.m. and 8 p.m. a.m. in the morning. Those are the times, the main times, but your flush occurs at 9:45, okay? So those are your dates. So at 6 p.m., take your first dose of 15 Epsom salt capsules. You say, 15? Yes.
Wow.
What this does, it dilates your bile ducts. It dilates them so that you're about to dump a lot of junk. You say, well, is it going to cause diarrhea? Usually it doesn't right away. It will later, but it doesn't right away, okay? So at 6 p.m. you take your first dose of 15 Epsom salt pills. Then at 8 p.m. you take your second dose of 15 Epsom salt capsules. And then you rest. You don't be walking around, or else things will start moving, okay? And now at 9:45, you got to have all your things ready the morning before. At noon, you want to get everything ready. You want to have your grapefruit. You want to squeeze your grapefruit or lemon juice. You want about a half a cup of that. You want a half a cup of organic olive oil. You want your tablespoon of maple syrup. You add all of that to a pint-sized mason jar, and then you want to shake it vigorously for 20 seconds. So you shake it really good for 20 seconds. Then you take your straw and you sip on it for 10 to 15 minutes. You want to sip it all. You want to be done by 10 p.m. And then you want to lay down and before you do that, you want to take your 8 L-ornithine capsules because it helps you sleep. It's going to put you in that deep sleep. So you got to take your L-ornithine right after you take your drink.
You're not going to have to go to the bathroom after this?
Well, no, most people don't. Or if it is, it's only 1 or 2 times at night, usually. But that helps you sleep. Then you also take 2 black walnut capsules, because all of a sudden those parasites will come out and you're going to start pulling them right out. It'll start to kill any parasites too. You say, I thought I got them all. But diatomaceous earth, this just gets them out of the gallbladder. Sometimes they get up in the gallbladder.
Wow.
And then once you take your gallbladder drink, you immediately, you go to bed. You don't get out of bed unless you have to go to the bathroom, and you don't eat for sure. You lie down flat on your back. Some people would turn on their right or left side. It's best to lie flat on your back with your head raised on a couple of pillows. Okay, and then try to keep perfectly still for the first 20 minutes, because your stomach doesn't feel that good after drinking all this. Okay, there should be no pain because the bile ducts are open due to the Epsom salt capsules you've taken. Now, you may have to get up 1 or 2 times during the night to go to the bathroom, which is normal, okay? And then at 6 a.m. in the morning, you take your 3rd dose of 15 Epsom salt capsules.
Wow.
You do that at 6 a.m. And then you will have diarrhea, and start checking for gallstones. And your stool will sink, your gallstones will float. But do not take your Epsom salt capsules before 6 a.m. This is real important. You take them 6 p.m. the night before, 8 p.m. the night before.
12 hours.
Right, but then 12 hours later, you take that at 6 a.m. and then again at 8 a.m. At 8 a.m., take your final dose of 15 Epsom salt capsules. At 10 a.m., have a small glass of juice. You can have 4 ounces of orange juice or apple juice or whatever juice you want. Then at noon, have a bowl of bone broth soup. And then at 2 p.m., you can have another bowl of bone broth soup, and don't put any oil in it, please. No butter, no olive oil, and add some veggies to it. Wow. And then by dinner, you're back to normal. You can eat normally.
This is a 24-hour ordeal.
Yeah, but it works, and a lot of people swear by it. But
That's
just
incredible.
Make sure you get.
So you have to set aside a day.
Oh, you do.
Like a weekend.
Well, Mary, it's no worse. It's no
planned.
worse than a colonoscopy.
Well, I mean,
it's about the same.
Yeah,
and
which
people
is
get
pretty
so
bad.
much more out of. People get 1,000 times more out of this than they do colonoscopy, because you'll start to see all those little stones.
That's incredible.
It really is, and my patients swear by it. We've been doing this off and on for 30 years.
Now, don't panic. We're going to put all this on the website.
We'll put it on
You're
the
going
website.
to see it on this video, actually. Our tech guys are really good about putting everything up there. We're going to make sure he has them.
Now, some people do this every 1 to 2 years. Some people just do it once, and then they just stay on the Beyond Keto diet, and they don't need it anymore. But if you still cheat a lot, you're going to have to do this every 1 or 2 years, okay? Like I still have this patient, she still does every 1 to 2 years because she won't follow my Beyond Keto diet.
Yeah.
Which is the healthy keto or Mediterranean diet. Now, if you have
and she has gallbladder issues?
Well, as long as she does her flush, she's fine.
Okay.
Okay, now, if you have gallbladder pain, apply a heating pad or a warm, wet towel to the right upper abdomen for about 10 to 15 minutes at a time. Or some people do a castor oil pack where they get a piece of flannel, they soak it in castor oil from the health food store, they lay it over their gallbladder with a heating pad for about 15 minutes. It works wonders for a lot of people.
Okay.
To ease spasms, you can drink peppermint tea or drink 2 tablespoons of organic apple cider vinegar and 4 ounces of warm water. And they can do this, every 3 to 4 hours as needed. Or you can use powdered magnesium, 1 teaspoon, and 4 ounces of warm water, and drink it every 3 to 4 hours. Either that or apple cider vinegar.
And what is this for?
This is for gallbladder pain spasms.
Okay.
If they're having pains, like if they don't want to, they're not ready for the flush yet, and they're having spasms, this will help the spasms.
Okay.
Now, meds for gallstones are number 1, Actigall. Actigall has been around for decades, Mary, and it's just a bile acid. There's another one called Chenix, Chenix, but Actigall is the best, Actigal. It's a bile acid that helps dissolve cholesterol gallstones. Now, if they're calcified gallstones, it's not going to work. There's 3 kinds of gallstones generally. There's the cholesterol, which are 90%. There's the calcified stones, and those Actigall does not work on. And then there's the pigmented stones that are made up of bilirubin, and it doesn't work on that either. okay? But those are not very common, the pigmented. Now, the Actigall can dissolve 80% of gallstones less than 5 millimeters in diameter.
Wow, that's wonderful.
But if they're bigger than 5 millimeters, it's probably not going to work. Within 6 months, that's how quick it does it. Now, after a successful dissolving of gallstones, stones usually return in 50% of patients within 5 years due to high cholesterol. You got to get your cholesterol down. You got to follow the Beyond Keto diet or get your cholesterol down. Natural means, listen to our podcast or YouTube video on lowering cholesterol. I go through the natural means to do it. And then there's also extracorporeal shockwave lithotripsy is a non-surgical alternative to manage gallstones. But the gallbladder must be functioning normally, and the stone should be small. But this is how we treat calcified gallstones. The calcified gallstones are radio opaque. They show up on an X-ray. That's calcium. But the lithotripsy, or extracorporeal shockwave lithotripsy, can literally shatter those stones. And then we can do the above measures I talked about to clear the junk out of the gallbladder.
Wow.
Isn't that great?
It's great. Wow.
So that's a full talk on gallstones, gallbladder disease.
Oh man, you have
everything you need to know about
a ton of information. Well, I sure am glad we've done this on a video. People can replay it and listen and slow it down, and
there's a lot to it.
You'll be able to get all the information. Be sure and go to our website, drcolbert.com. We have the fiber. You need our fiber. Everybody needs our fiber. The key, Beyond Keto, and we actually have Beyond Keto Cookbook as well. So there's recipe ideas that you can include as a part of your program.
And the Carb Assist, because it has the alpha-lipoic acid, it lowers the sugar, and again, all that processed carbs, sugar, and bad fats are what trigger these gallstones.
Yeah. So I know it's a lot of information, a lot of information.
But it's good. It's going to save a lot of gallbladders.
It sure will. We thank you for watching. Share this video. Please do share the video with your friends and family, and hit like on the YouTube. That helps promote the YouTube. We want to get this information out. Don is working very hard to try to find alternative, healthy, preventive measures. And you can partner with us when you come on to divinehealth.com, drcolbert.com, and partner with us each month in one of our supplements or all of our supplements.
You don't need them all.
I don't need them all, he said. It helps us in what we're doing. And we bless you and thank you. And we pray you walk in divine health. God bless you.